Hello and welcome to another episode of Mask or Peace Theater. I am your host, Professor James Pretentious. Join us today as we look at ways in which we can hold back this pandemic from wiping us all out. How can we slow the spread? That is the big question that we will be answering today. Join us as our medical professional team endeavors to answer this question.
So we've been told by health professionals that the best things, and Andrew, you mentioned this, the best things that we can do to help slow the spread of the disease is hand washing, that masks do provide some benefit, that social distancing also because of the nature of droplets and all the rest. But we also know that we ultimately are just, we're not able to sort of just stop it, put an end to everything. But as health professionals, when you look at how people in their everyday lives can make adjustments that will make the most impact, what do you guys see as the most important things for us to remember?
Well, so I read a really interesting study the other day that I thought was very illuminating in some ways. For those of you who don't know, there's a superbug called MRSA. And it's been with us for a long, long time. It's really, we see a lot in hospitals, and all of us have seen, we cringe when we see isolation cards in front of rooms, because we know there's a MRSA patient potentially, and we gotta do a bunch of extra things. We gotta put gowns on, we gotta put gloves on, it's cumbersome. And what I found really interesting is I recently read a study that some hospitals are showing 60% declines in MRSA. And the reason, and that's during the pandemic, and the reason that is people are washing their hands a little bit more. They're instead of, kind of being independent or outsider looking in, their foot's in the fire, so to speak. I mean, if you get coronavirus, it's not as benign in some ways as a MRSA for a healthy individual. So we're washing our hands more a little bit. Maybe we're using the alcohol hand sanitizer a little bit more. And so one of the reasons I want to bring that up is it works. I mean, it actually kills the virus. It kills the bacteria. And there's a reason we have it there. And so I just want to hit that, encourage you, if you can, have some hand sanitizer in your car. Have some hand sanitizer at your workstation. I know it's simple. I know it dries your hands out. I know it makes your food taste bad after you eat right afterwards. But it's really helpful. And it actually does some good. And just little things like that where we can, when needed, get some distance from people. Don't touch your face. Wash your hands. Those are all, it's the cumulative effect, kind of like Andrew was saying, and Aaron, we've talked about this. There's a cumulative effect of that. The more you do, the better it is overall. And I mean, I think I can speak for everybody, it's a way we can love people. It's a way we can show love to other people. I'm healthy, I'm young, I'm not necessarily that concerned about me catching the virus, but I have parents. You guys know my parents. I love them. I want them to be healthy. They're not a huge risk factor, but they're older, so they are a little bit higher risk. There's other people around you in your life that you love, and that may be a higher risk. And so I see this as a way we can just kind of love other people. And even if we're not at high risk, doesn't mean we have to be scared, and doesn't mean this has to be fear-based. But it's, in my mind, a way we can show love to others just by doing the little things. It might be a little bit inconvenient, but it does good. And kind of on a off way, that MRSA data kind of brought me back around to like, well, I guess it shows that, we actually are increasing our hand washing, our hygiene, and our practices, and it actually is being effective.
Not just hand washing, but washing down your local work surfaces and things like that too. It's actually kind of interesting that I literally have been swimming in COVID since beginning of March, like daily. I swim in it, and according to my blood work, I've never even been exposed to this stuff. So how do you swim in COVID that's so virulent? and not ever get exposed? And the answer is, and not within the context of initially, we were even told that within the ICU, there were studies being done, not at our hospital, but at others, where they were going down, not in patient rooms, but in the central corridors and in work areas. They were taking swabs of like windowsills that never
And the
get touched.
floor. Yeah, I remember seeing that.
Different areas of swabbing random areas in common areas, not in patient rooms even, and they were finding COVID there. So if with that said, and it kind of freaked all of our staff out a little bit when we saw this, we're like, great, well, why even bother wearing a mask? Because there's no escaping it, it's everywhere, and there's nothing we can do about it.
Yeah.
But the truth is, I would argue, and the evidence, as Alan has pointed out, is that the hospital's probably never been cleaner and a safer place to be.
Yeah.
Dead serious. People are walking around. We had teams of people that normally had other jobs to do. Their jobs were discontinued because we stopped doing elective surgeries and things like that. They were repurposed to walk around with sanitation wipes and wash surfaces, handrails, walls, doorknobs. Every time I come out of a COVID room, I have a very specific method for how I step out of the room, stepping onto sanitation cloths. I wash my shoes, I wash my mask. Everything happens in a very specific sequence and it's very rehearsed, and I never make an exception to that.
Yeah.
No matter how much of a hurry or what the emergency is, I always follow the same methodical process. And that involves literally washing the doorknobs that I touch on my way, changing my gloves in between, getting new gloves and new sanitation wipes, washing my shoes. I shower in chlorhexidine before I leave and come home to protect my family, not because I'm afraid of being dirty, but to protect them and my in-laws, who have their own health issues. So really, the hospital has never been a more sanitary place than it is right now, and it's because it's a universal approach.
Yeah. So I've noticed that over the past few months, there are certain things that we just all took for granted for a long time that I'm not quite so okay with anymore. So for instance, when you go to a restaurant and they hand you one of those coaster beeper things that, while you're waiting for your table, and my mom, who was a nurse, would always say that those things are the dirtiest thing in the restaurant. And so she would ask people, how often do you clean those? And every single time they would say, we never clean those. And I think that nowadays, if you walk into a restaurant, that there's a much higher likelihood that thing's getting cleaned, although you still don't know. But it like brings to mind those things that perhaps we could always have been doing. But the reality is oftentimes throughout life we find ourselves in a hurry, so we don't do this, or we figure, well, this is not such a big deal. And now, for the first time in many of our lives, we're looking, and especially for those of us that are not medical professionals, and saying, this thing that I do could impact somebody else that I care about, and so I'm not going to do that thing.
Well, first, for me, I try to keep this in perspective. First of all, God gave us amazing immune systems, and 99.4% of us are going to recover and survive from this. If you're in an older category, it could be a little less than that, but it's still, this isn't Ebola where you have a 50% mortality rate. So I try to remind people, God has given us an immune system equipped to handle this. And I think as Americans, a tendency I've seen in medicine is people don't want to be uncomfortable. They want to be fixed immediately, like fast food. And you have to remind people, this isn't fast food medicine where you drive by and you get your Z-Pack and bing, you're better. It takes a little bit of time to recover, but 99+% of people are going to be fine. So I try to remind them of that and, tell them to go out and do things that they enjoy. I think we can get so focused on it that we, can get bogged down in everything we touch and feel, but our immune system was designed to handle multiple things coming at us and to combat it. So I try to put things in perspective, because I think the media does try to sell a little bit of a panic mode to people. I don't know why they like to put people in fear, but that seems to be, when I watch the media, that seems to be the goal. And coming from somebody who's been on the ICU side and the outpatient side, where I see the majority of people having mild cold and flu-like illnesses and getting better, it's not doom and gloom for everyone like the media wants to make it sound like. And the other thing I would say to prevent you know, in terms of transmission, I think most of us are going to get this.
Mm-hmm.
You know, the goal with this, with the distancing and hand washing, was to flatten the curve so hospitals weren't overwhelmed. And at first we were. I believe the virus is mutated.
Yes.
We don't have these sick cases that we saw that were pretty frightening, honestly. But and Andrew could tell me more. I haven't been up there in the last couple months, but I know in urgent care, I'm not seeing people that I need to send straight to the ER that go, and I know they're going to be dead in a few days. So I think we've got a mutated virus.
Anytime there's something novel that comes in, there is a certain percentage of your herd, of your population, that is going to be eminently threatened by that. And essentially a portion of those, you know, once it gets through that first layer, the really susceptible layer, you've got more resilient layers below that. Everyone, I believe personally, including myself, will probably get this within the next year to 2 years. It is absolutely not going away. We are not going to get rid of COVID. Okay, we've tried for centuries to get rid of the common cold and influenza.
Yeah.
We have not gotten rid of either
So
one, and we will not get rid of COVID.
It's
But we will mitigate it.
there's one form of rabies that we've gotten rid of, and like
Smallpox or
polio, except in some parts of the world. But basically, over the course of medical history, there's almost no diseases that we've just boom wiped out. But what we do is, like you said,
We mitigate.
mitigate.
We mitigate, and that's what the procedures that I go through at work are more extreme than what I go through at home. I try to
Sure.
remember, you know, so if you're sick, don't go to work, don't go to school, don't, you know, like consciously pass it on basically to the people you're around. That's basic for a cold or, you know, anything else. It's just common. But how many of us don't do that? I mean,
Right.
even as healthcare workers, we know, and probably ourselves, have gone to work sick in the past.
Yeah.
Well, we've been
Because-
punished for not going to work.
And
before.
even that can be the case too.
Yeah.
But we need to understand that when you're dealing with something like this, out of love and respect for the people that you are going to take care of, and the people at home, and the grandparents, and everyone else, not to mention the fact that you really need to be healthy so you can show up at work. Because if any of us can't show up at work, other people pay the price.
Yeah.
Our coworkers pay the price, and other patients pay the price for our lack of ability to be there and care for them. So the procedures I use at work are very extreme, but they're rational within that context. I think being rational within the context of where you work and where you live is going to look different for everyone. There isn't a cookie cutter one size fits all for this, but they're basic steps to mitigation that we've already talked about, and I feel like are really the essential pieces you need, and also the flexibility and understanding that, yeah, at some point you're probably going to get this.
Well,
I am.
The last thing
I've
I
just
would
been
say
fortunate.
is, you know, the best offense is defense. So, you know, I go to the grocery store, I'm not trying to sound judgmental, but I look in people's grocery carts and it's full of food that isn't even food. It's plastic bags of goo. And yet and I'm not trying, it's just because I work in healthcare.
Yeah.
There was a big
You
article
know.
about this recently. There was a study done in the Lancet
Oh,
that
really?
talks about nutrition as being a primary cause
Yeah.
for this potentially.
Get your body, I mean, you are going to most likely get this. So to me, it's how can I optimize my body through health, nutrition, exercise, you know, to prepare for being able to fight this off.
Real quick, they actually looked at other countries and their contraction rates and their diets associated compared to the United States. And there are actually some powerful trends when it comes to diet, nutrition, and your susceptibility to this.
What would be one piece of practical advice for somebody who knows that they're not as healthy as they should be, and they're looking at it and they're saying, well, maybe now is the time to do one thing differently? What would you recommend? Let's start with Jessica.
I would say start small. I feel like people think they need to change their whole diet and lifestyle all at once, and that's overwhelming. And to me, like, start with breakfast. You know, start with one thing.
So if they don't eat breakfast, they should.
They should.
And if they
Something healthy.
and so for example, should they eat you know 3 pieces of toast and with tons and tons of butter on it? What would be one good breakfast?
Well, we do smoothies in our house, and somebody's inevitably gonna say, "I hate smoothies." I've had this happen, but you know, we put chia seeds, flax seeds, almonds. We kind of, you know, we use almond milk. You can use regular milk, but do some protein powder, and that's how we start the day. It's full of, you know, omega-3s, healthy fats, some fruit, some protein. So it's a good start to your day.
Yeah, Al, what would you say?
I would say, if you've never done this before, take a journal of what you eat. And actually, this is a little tedious, but it's very helpful in a lot of ways. Just take a journal of what you eat. Write down the calories. There's apps. There's an app for everything, right? There's an app for this. And it actually helps you track like your macronutrients, your protein, your fats, your carbohydrates. It breaks it down. And what other nutrients you have in your diet. But I mean, just be honest with yourself. I mean, nobody's looking, you can't cheat on it, right? But just write down what you eat. I mean, if you're 1,000 calories above what you should be getting, and there's whole formulas for that, you can look up, and it should be on those apps as well. This is really helpful. It's a good jumping off point. Like, you don't know what you got to change until you know what you know. And so that's a good jumping off point. At least try and get a log, get some information for what, maybe you have a perfect diet, in which case, I mean, good for you.
Yeah.
That's great. But if you're like most of America, we probably don't have the best diet, and we can probably do a couple things to make it better. And like Jessica said, is, you know, let's not, you know, just jump out and like, I'm not going to do any sweets, I'm not going to do any breads, I'm not going to do, no, you don't have to do like a huge overhaul, but at least get some information. Some information is better than no information. If you just kind of blindly go about saying, I'm going to do this, well, I don't know if that's a good choice or not. I mean, if you're diabetic, don't just change things. I mean, you got to know what you're doing. You got to know what information you have in before you go and change things. So get information. If you have concerns, again, we're going to refer you to your primary care physician. They know you. They know what you have. You don't have to tell us any of that. But just get a baseline of where you're at, and then make small changes from that point.
Excellent. Andrew, what about you?
So of the people that we have in the critical care unit in general, the vast majority are over 60, certainly over 65. And when you're talking about the sicker population, the ones who are less than that typically are obese, i.e. greater than 300 pounds usually, up to say 600 pounds or so. And the other one would be chronic disease mismanagement or fear of management, running out of prescriptions, things like that. So I think my answer to the question would be manage with your doctor your chronic disease processes and don't ignore them.
Excellent.
If you are overweight, there's lots of ways. There's coaching and diet and your physician, and there's weight loss systems and whatnot. I'm not advocating people just go out and diet, but if you are over, say, 200, 300, 400 pounds, if you're one of these people, you are very, very high risk, regardless of your age. I've seen that time and time again, and it's very difficult to manage those cases. And then heart failure, COPD, all these chronic illnesses, get with your physician. Manage those chronic illnesses. Don't ignore them. And if you have been maybe not the best at managing them, it's time to get good at managing them. Invest yourself in yourself. That's the best thing you can do.
Yeah, I just wanted to add, so I have a friend who's within a decade of my age who got incredibly sick with this. And the reason I'm saying this is, so I actually just talked to him the other day. This happened 3 months ago. He was in the ICU, very sick. They weren't sure if he was going to make it, young, and he's still on oxygen 3 months afterwards. So I get the only reason I bring this up is as with all things, there's a tension. There's a balance between having a realistic understanding of what we're doing and also having a realistic understanding of other people. When he goes out, he had a life-altering event with COVID. When he goes out, he wears a mask. His family wears a mask, and if somebody comes close to them without a mask, they are scared, and I get that. The only reason I want to bring this up is it's always helpful to remember there's a whole other story that oftentimes we are completely ignorant to. And so that's another way we can just show love and not assume we know all the answers, all the concerns, all the life experiences these people are coming from. because we all have different backgrounds and different life experiences and the way this has affected us. So it's always good. I encourage everybody to have some grace in that.
Amen.
Be willing to ask questions. And don't just assume like, well, they're wearing a mask, they're scared. They're not wearing a mask, they must be, ignorant of science. Like, that's typically, rarely is it that black and white. So I just wanted to encourage everybody to have a little bit of grace, measured grace, and just understand, like we were talking earlier, there is a tension. Don't be so scared that you are paralyzed with fear.
Excellent. All right. So another question: how much coffee is too much coffee?
Oh my goodness.
That's a tough one.
Sure, yeah.
Is it true that 5 to 10 cups of coffee a day will mitigate your possibility of getting Alzheimer's, because you'll probably die of hypertension instead?
Die from a cardiac
Beef.
Yeah.
Note to self: 3 pieces of toast is not the answer. Okay, so there was